The first wealth is health. That's Ralph Waldo Emerson, and it really does set the scene perfectly for what we're getting into today.
Absolutely, a fundamental truth.
Welcome to the deep dive. This is where we try to cut through all the noise, get to the core data, and give you those insights you really need.
Making sense of the complex stuff.
Exactly. And today, well, we're tackling a really pressing global health challenge. It's got huge implications everywhere, but maybe especially for a country like India, given its scale. Our main source here is a really significant new analysis. It's just out in the Lancet.
A top journal, yeah.
Right. And it's put together by the Global Burden of Disease Study Vaccine Coverage collaborators. That's quite a mouthful, but it represents this huge ongoing international effort. They're systematically measuring the world's health problems.
It's a massive undertaking, really valuable work.
So our mission today, let's unpack this data. Let's try to understand the complexities around vaccine coverage, look at the challenges, and figure out what it all means for global public health, for millions of kids, and crucially for you, especially maybe if you're preparing for exams like the UPSC or, just want to be a properly informed citizen.
And this specific focus, the unvaccinated kids, the ones often called zero-dose children, it's just so vital.
Why zero-dose specifically?
Well, understanding why these kids miss out on even the first routine shots, it gives us a really sharp lens on current global health trends, the real strength or weakness of our health systems.
Right.
And, well, the big challenges we're definitely going to face down the line. These aren't just numbers on a page.
No.
They're a real indicator of equity, access, basic societal health.
Okay, so let's talk numbers then. The scale of the challenge. What does the Lancet report actually tell us?
Yeah.
And where does India stand in all this? Because the figures are quite stark.
They really are.
The report says nearly 14.4 lakh children in India didn't get a single shot of any routine vaccine in 2023. 14.4 lakh, that's 1.44 million.
It's a staggering number.
And it puts India second highest globally for these zero-dose children. Just try to picture that scale.
And it's concentrated, too. The report makes that very clear.
Yeah, globally it says more than half of the 1.57 crore, that's 15.7 million unvaccinated kids worldwide in 2023 lived in just 8 countries.
Just 8. That concentration is, well, it's deeply concerning.
And which countries are we talking about?
Okay, so the report breaks it down, and there's a clear regional pattern.
Yeah.
About 53%, over half, are in Sub-Saharan Africa, and another 13% in South Asia.
Okay.
Topping the list is Nigeria, with 2.48 million, or 24.8 lakhs zero-dose kids.
Wow.
Then comes India, at that 1.44 million figure we mentioned.
Right, 14.4 lakh.
Then you have the Democratic Republic of Congo, around 882,000, Ethiopia, 782,000, Somalia, 710,000, Sudan, 627,000.
Still huge numbers.
Huge. Then Indonesia, about 538,000, and Brazil, around 452,000. Looking at that list, it just screams global inequity, doesn't it?
It really does. And the WHO, the World Health Organization, they warn this puts these children at, well, immense risk, life-threatening diseases.
Exactly. These are preventable diseases we're talking about.
That WHO context is so critical. When you hear numbers like 15.7 million globally or 1.44 million in India, it's a lot to take in. But it makes you wonder, has it always been this bad? Or did we make progress and then sort of slip back?
That's a really important question, because there is a history here, and it's quite revealing. This report, it was funded by JEI, the Vaccine Alliance, and the Gates Foundation.
Okay.
And it actually shows, perhaps surprisingly, some incredible progress before things went sideways. Between 1980 and 2019, think about this, the number of zero-dose kids globally dropped by 75%.
75%, that's huge.
It's massive. From around 5.68 crore, that's 56.8 million, down to 1.47 crore, or 14.7 million, right before COVID hit.
So a major public health success story, really.
Absolutely. It showed what sustained effort could do. And on top of that, overall vaccine coverage between 1980 and 2023, it actually doubled for key diseases. Things like diphtheria, tetanus, whooping cough, measles, polio, TB.
Doubled. Okay.
But, and this is the big but, despite that amazing track record, we're now in a situation where progress has just, stalled.
Yeah.
Or even reversed in a lot of places.
And that's the crux of it, isn't it? The report says it directly. But since 2010, progress has stalled or reversed in many countries. So this isn't just a pandemic blip. This started earlier.
The trend predates COVID, yes.
Yeah.
Though the pandemic certainly didn't help.
Right. Like measles vaccination, you mentioned that's a key one. Coverage declined in 100 out of 204 countries between 2010 and 2019 before the pandemic really hit routine services.
Exactly.
And then we have that 2023 figure again, 1.57 crore, 15.7 million kids missing all doses of the DTP vaccine, diphtheria, tetanus, pertussis in their first year.
The foundational vaccine, really.
So the big question is, why? What happened after 2010? What changed that trajectory after decades of, such great strides?
Well, it's not just one thing. It's complex. The report and the experts involved point to several factors. Dr. Emily Hauser, she's the lead author. She put it quite plainly. She said, the challenge now is how to improve vaccine delivery and uptake in areas of low coverage.
Delivery and uptake, two different things.
Exactly. And she stressed, the world's going to miss the 2030 immunization goals unless we get really targeted, equitable strategies. We need stronger primary health care. And critically, we have to tackle misinformation and vaccine hesitancy.
Okay, so let's break those down. What were the biggest drivers of this stall and then the reversal?
Well, the most obvious recent disruptor was definitely the COVID-19 pandemic, no question.
Right. Health systems were just overwhelmed.
Totally. They had prioritized COVID care, which was essential, of course, but it just knocked routine immunization services sideways. Schedules disrupted, clinics closed, staff redeployed.
Makes sense.
But it wasn't just logistics. The pandemic also triggered a pretty significant drop in public trust. Trust in health institutions, trust in government advice.
Yeah, you saw that everywhere.
And opinions on vaccines, even routine childhood ones, became really polarized. It wasn't just about the COVID shots anymore. That doubt, that hesitancy, it sort of spilled over.
That's fascinating. So a specific crisis eroding trust in long-established programs. Were there other things going on even before the pandemic hit?
Oh, absolutely. Independent experts, like those interviewed by The Print, they keep highlighting that misinformation and vaccine hesitancy, they've constantly remained barriers.
Not new, but maybe amplified.
Amplified, definitely, especially with, how fast information and disinformation spreads online now.
Yeah.
But there's another layer, too. Dr. Ishwar Galata, he's an infectious disease specialist.
Okay.
He pointed out something quite specific. He said the number of zero-dose kids has been persistently, well, maybe not high, but present in certain communities. Some tribal groups, some religious minorities.
Why them specifically?
Yeah. He mentioned a reluctance, often rooted in a fear of serious side effects from routine vaccines. It highlights that hesitancy isn't always the same thing everywhere.
Right, it's not monolithic.
Exactly. It can be tied to very specific cultural beliefs, maybe past negative experiences with the health system, or even targeted disinformation campaigns aimed at those groups. It needs really careful, culturally sensitive engagement.
That's such a crucial point. Public health isn't just policy papers. It's about understanding real people in real communities. Okay, let's zoom back in on India specifically, because it's a fascinating case. You said India's consistently been among the countries with the highest numbers of zero-dose kids.
Yes, the absolute numbers have remained high for decades.
Right.
Back in 1980, over half, 53.5% of all zero-dose kids globally lived in just 5 countries. Right. India was one.
And more recently.
By 2019, just before the pandemic, it was 52.8% living in 7 countries. Again, India was still on that list.
But India has a big immunization program, right?
It does. A very comprehensive one, actually. The Universal Immunization Program, UIP. It's run by the central government.
What does it cover?
It offers vaccines against 12 different diseases, completely free of cost, to all children, and some for pregnant women, too. It's delivered through government hospitals and health centers.
And that covers the main ones, like the WHO recommendations.
Broadly, yes. The WHO recommends 11 specific 3 vaccine combinations globally, and the UIP aligns pretty closely with providing protection against those key childhood diseases. It's a massive public health effort.
So the framework is there. The vaccines are, in theory, available and free, yet the numbers remain high. Why the disconnect?
That's the puzzle, isn't it? It suggests the challenge isn't primarily about just having the vaccines. It's about the last mile. Meaning actually getting the vaccine from the storage facility into the child's arm. Think about India's diversity. You have remote Himalayan villages, dense urban slums with people moving in and out, vast rural areas.
Huge logistical challenges.
Exactly. Linguistic barriers, cultural beliefs we touched on, maybe lack of awareness in some pockets, difficulty reaching nomadic or migrant populations. Even a strong national program can struggle to overcome those without really tailored local approaches.
And this brings up an interesting point about context. The Indian government, the Union Health Ministry, they pushed back against a UNICEF report last year on similar figures, didn't they?
They did. Their argument was that these kinds of reports can give an incomplete picture.
How so?
They argued the reports often don't adequately factor in the sheer size of India's population base when comparing raw numbers with other countries, or the overall immunization coverage rate within that huge population.
So percentage-wise, coverage might be better than the raw number suggests.
That's the implication. Context is definitely important with a population over 1.4 billion. Dr. Gulata also mentioned this.
Right, the infectious disease expert.
Yes. He said it's paramount that people saw these figures in context, considering India's population. A high number of zero-dose children is terrible, obviously, but in a country that large, the percentage might look different compared to a smaller nation.
Okay, that's a fair point for perspective.
But importantly, Dr. Gulata also stressed that even with that context, India absolutely needs to prioritize reaching those specific groups with low vaccine acceptance. Those tribal and religious minority communities, he mentioned, where specific fears or reluctance exist.
So it's both context and targeted action needed.
Precisely. It's not an either. And looking broadly, the report is clear. South Asia and Sub-Saharan Africa, including India, need substantial increases in coverage and face the biggest hurdles to meet those global goals.
Okay, so let's connect the dots for everyone listening. For you, maybe you're studying for UPSC mains, you need to know current affairs, maybe it's for prelims, or maybe you just want to understand global health better. What's the takeaway here?
Well, I think
Understanding these numbers, and more critically, the reasons behind them, the system issues, the trust factor, the community specifics, it's absolutely vital.
it really is.
This isn't just about stats for an exam. It's about grasping public health policy in action, how it links to socioeconomic development, how global cooperation works, or sometimes doesn't work as well as it should. These numbers represent the health, the future of millions of children, and they tell us a lot about how resilient our health systems really are.
And what's so striking, I think, is seeing that direct line from a global goal set by international bodies right down to the challenges faced by a health worker in a specific village or neighborhood.
Yeah.
How national strategies play out on the ground, interacting with local beliefs, local trust, local infrastructure. It really raises a fundamental question, doesn't it?
Which is?
How do we best balance these universal health goals, like getting every child vaccinated, with the need for culturally sensitive approaches? How do we address the unique challenges different communities face without compromising the goal?
That's the tightrope walk.
It is. And this deep dive really underscores that achieving something like universal vaccination isn't just about having the vaccine vials. It's not just about the science. It's just as much about building trust, effective communication, strong local health infrastructure, and adapting constantly to meet very specific, very human needs.
It's the human element, always.
Always. It's a complex human challenge as much as a medical one.
And understanding that complexity is key. Well, thank you for joining us on this deep dive. We've tried to unpack this significant challenge, zero-dose children, globally and in India. We've looked at why progress stalled and the many layers involved in fixing it.
Hopefully shedding some light.
That's the aim of the deep dive, helping you get knowledgeable quickly, thoroughly, finding those aha moments without feeling buried in data. If this was useful for you, please do like, subscribe, maybe leave a comment if you have questions. It really helps us keep these conversations going.
And maybe one final thought to leave you with, building on all this. Consider this. The path to better global health isn't only paved with scientific breakthroughs. It relies just as much on really effective, empathetic communication, deep community engagement, and truly understanding human behavior. So the question for you to ponder is, what steps do you think are most critical now to bridge that gap between the vaccines we have and the millions of children who still desperately need them?